Okay, everybody, Dr. Rayfitch here, Vet Triage. We are continuing through this issue of JAVMA from January 1st, 2016, and we are tackling a what is your diagnosis. This is in a horse and a filly. What you're seeing here is transverse computed tomography or CT images of the cervical vertebral column in a 7-month-old quarter horse filly that was evaluated because of neurologic deficits including paresis, forelimb dysmetria, difficulty rising from recumbency. The horse had a 1-month history of this, along with tachycardia, mild bilateral flexural limb deformities of the metacarpophalangeal and metatarsophalangeal joints. Its head and neck was to the right while walking. It was weak, knuckled over, and neurolocalization suggested a cervical myelopathy. Complete blood count and biochemistry was normal. They performed a computed tomography myelography and cervical radiographs. The study comes out of the vet school in Iowa. What you're seeing here in the images, here we go. You see here in A, the myelographic contrast column is narrowed dorsolaterally along the left side. So right here, this part here, the contrast column is narrowed or absent. There is a small concave defect present in the subchondral bone of the left cranial articular process of C7. So that's right here, that spacing there. There is a hyper-attenuating curvilinear area in the soft tissue dorsolateral to this joint. So that's right here, this boomerang-shaped bony material. And then in B, here, the dorsal lamina of C7 is asymmetric bulbous thickening of the bone on the left side. That's this bumpiness here. Diagnostic imaging findings interpretation. They used iohexol for the myelogram. On CT, there was mild attenuation of the myelographic contrast column ventrally along the spinal cord at the level of the caudal aspect of C6 and along the left dorsal aspect of the spinal cord at the level of C7. The subchondral bone of the left cranial articular process of C7 has a small concave defect, a thin curvilinear mineral density within the soft tissues adjacent to the caudal extent of the left articular process joint of C6-C7 is evident. The left dorsal lamina of C7 is bulbous in a plane caudal to the left C6-7 articular process joint space. These changes are consistent with chronic mild degenerative joint disease of the left articular process at C6-C7. The curvilinear mineral feature dorsal to the left C6-7 process joint might be dystrophic mineralization within joint capsule or mineralized joint body. Possible conditions include osteochondrosis, osteochondritis dissecans, or trauma. And then here you have radiographic imaging there with myelogram. The head and neck are extended. Approximately 50% and 100% narrowing of the dorsal and ventral contrast columns, respectively, are seen as C6 and C7. That's right here. Cerebrospinal fluid was collected from the atlanto-occipital joint, which was normal. They suspected osteochondrosis dissecans at C6, C7. They euthanized the horse. Gross necropsy confirmed an osteochondrosis dissecans lesion of the left articular process of C6, C7, characterized by 1.5 by 1 centimeter cartilaginous flap covering an irregular focus of erosion and ulceration of the articular cartilage. Axonal degeneration was observed in the adjacent segments of the spinal cord, indicating that this lesion and associated spinal cord degeneration contributed to the neurologic signs. Scattered perivascular inflammatory foci in the adjacent spinal cord and were speculated to be inflammation from the remodeling of the instability of the cervical vertebrae. Comments. The early identification of the early definition of osteochondrosis implies an underlying lesion in the joint cartilage that facilitated formation of loose bodies in the absence of major trauma. The term has evolved to describe a developmental orthopedic disease caused by the formation of cartilaginous clefts extending through the articular cartilage into subchondral bone. Clinically, when a fissure or fracture in the overlying articular cartilage is present, it is referred to as osteochondrosis dissecans and describes a situation in which epiphyseal growth cartilage becomes separated from the underlying subchondral bone and is accompanied by a reactive inflammatory response at the bone surface beneath the line of separation. Simply stated, osteochondrosis is the disease, osteochondritis is the inflammation from the disease, and osteochondrosis dissecans is where there's a flap of cartilage or osteochondral separation is present. Radiographic changes may include discrete osteochondral fragments, alterations in the contour of the articular surface, irregularly shaped lucent zones in the subchondral bone, sclerosis surrounding the lucent zones, or secondary remodeling of joints. So they do say this is rare in the neck of horses, and I'd be interested to know if they took the horse to surgery, how it would have done. Obviously, they thought it was a poor prognosis, but and again, nothing in horses is easy. They're so big, and the rehab for them is so extensive because of their size. But it'd be interesting to know whether or not cleaning this area out surgically would have made a difference for this horse. Obviously, the horse had congenital issues because of the contracture of the limbs, as well as this bulbous formation. So maybe that's why they thought just cleaning up the osteochondrosis dissecans wouldn't have been enough, and dorsal decompression of the cervical spine would have maybe caused instability in the cervical spine, worsening the condition. I don't know, but unfortunate case, but also a cool thing to learn as well. So, all right, we'll see you guys in the next video. Thanks.